What's up, Ashley? I'm John Wall from the Washington Wizards, starting
Hi,
point guard.
John.
I'm doing good. How you doing?
I'm doing well. Thank you for this opportunity.
No problem at all. I picked the WHC hospital because my mom was diagnosed with breast cancer, and she spent a lot of her time there with chemo, and just the work y'all did there, making sure she was fine and giving her the best service possible was a big key for me. And I felt like that I should give y'all the opportunity to be able to get meals and get masks with all the tough work y'all are doing through this tough time of COVID-19. So I wanted to donate that to y'all.
Well, thank you. That's super gracious of you, and I'm glad that you had a good experience with your mom being here. I know that's not easy, so I'm glad that we made it easier for you. And I thank you for the meals that we got yesterday. We got Chick-fil-A. Who doesn't love Chick-fil-A?
I'm glad y'all enjoyed that. I'm glad I was able to partner with Chick-fil-A and thank them for helping me. And I just really want to know, like, what is your day like when you're going through this tough process of what we're going through in this world today right now with COVID-19?
So I'm a patient care manager, which in simpler terms is like an assistant manager to now 2 COVID ICUs. About 5 weeks ago, it feels like we started our journey being a designated COVID ICU. And since then we opened up another ICU, and every day is different, busy, but it's manageable right now, thankfully. But just very busy with patients either staying the same, critically ill, or getting sicker. And then we do see people getting better, which is nice and really rewarding, because it's a lot of hard work that's going into their care. So that's kind of how it is.
Yeah. Then also I want to know, like, what keeps you motivated? You know what I mean? Like, what because I know it's a tough time now. Like sometimes, like you said, some patients are getting better, some patients are not getting better. So I don't like what keeps you motivated to want to go to work and try to help these people every day.
So I think being a critical care nurse, there's a part of you, and I think a lot of critical care nurses could say this, I think would say the same, is that there's, we like the challenge. It's not in a morbid way of just the critical thinking and being on top and preparing for the worst situation, what your day could bring. But I think the care that we're delivering now, for me at least, is more impactful than any care I've ever given. It's new to the doctors, it's new to the nurses, it's new to the hospital. This is something we've never treated before. And I think for years to come, it's going to be the most impactful nursing care that we ever give. And I think when I hear other nurses say that, that's what brings them to work 5 shifts in a row, day in and day out and week after week. It's because there is something rewarding about that you can tell your grandchildren that you were a frontline nurse during this pandemic, which hopefully will never happen again. So I think that's what brings me to work.
Well, that's dope, because like you said, it's a challenge for y'all and try to conquer this and beat it and figure out to get these patients back safe and back to their families. And that's kind of like, and I feel like we have a lot of challenges where people write us off and say we can't get things done. And it's something that motivates us to want to go. So I definitely want to know that. I just want to give a big thanks to you, Ashley, and all your patients and all your coworkers of all the work y'all are doing. I wish y'all the best of everything. Y'all keep fighting for this and trying to find the best cure for it and beating it. I wish y'all all well. And hopefully whenever we get this all under wraps and we beat this and conquer it, that I will invite you to a basketball game when the season starts back. So
I would love to
a great game.
Yeah, thank you.
Thank you so much. Hope you have a great rest of the day, and hope
you too.
Beating it. Thank you. Yes, ma'am.
Thanks. Take care.
Yes, ma'am.